One of the biggest complaints about cosmetic surgery can be recovery time. Now, one local doctor is promising to cut that recovery time in half and doing it without any scarring from surgery, too. Tonight, Team 6 anchor Keith Jones shows us how one doctor is promising no more scars.
I was tired of looking in the mirror and looking tired, but I wasn't tired.
A rejuvenated look is what Carl Albee wanted when he first considered a facelift. He knew of oral and maxillofacial surgeon Dr. Todd Sawich, but he didn't know what Sawich uses in this little white box is cutting edge in the healing and recovery process.
You come out of the surgery, you have all these scars, and you're kind of scared that it's going to stay like that, but it goes away really quickly. So I was fascinated on how quickly it healed.
We are very big in our practice into utilizing growth factors, whether they come from the human or whether they come from the amniotic tissues.
He's talking about stem cells, specifically amniotic stem cells, which are injected right into the scar or wound. Sawich says other surgeons use stem cell technology, but not placental tissue cells.
I am probably the only facial cosmetic surgeon throughout the country that's utilizing this particular regenerative process in his surgical techniques.
And it is a process. Sawich once used traditional stem cells from the patient, but that method was time-intensive.
You have to take tissue from a patient, then it has to be cultured at a tissue bank in a petri dish, and then it has to be regrown out, and that process takes time, and it's costly.
The doc uses amniotic stem cells from the BioD lab in Tennessee, which harvests cells from the umbilical cord or placenta. Staff will draw blood from the patient, separate it into platelets using a centrifuge.
Platelets have growth factors in them, so they're concentrated. We take those and we mix those with amniotic stem cells that we get from a tissue bank, and then we put them together to get a synergistic effect, and we inject them into the patient, into the surgical area.
Those newly injected cells take on the form of the tissue in which they're injected. For example, those stem cells become skin cells, or bone becomes bone. That's the technique Dr. Sawich used on Carl, nearly erasing the lines. These pictures show what his scars looked like at the time of the injection and after.
When we close this, we injected the stem cells into the surgical line that was here. And as you can see, over the course of a year, this area is healed up, and it's very difficult to even notice where the incisions were.
Wound scars, just one process Sawich has seen success. As an oral surgeon, he's actually seen bone regenerate by 40% in just 3 months by using amniotic cells.
We mix stem cells and growth factors with cadaver bone that we get from a tissue bank. We're able to regenerate bone within about 3 months where it's dense enough to place dental implants.
Skin rejuvenation reacts to this technology as well. Sawich can use it for skin anti-aging, a fountain of youth, so to speak, restoring collagen, increasing elasticity. And for those who are follically challenged, Sawich has injected these stem cells right into the scalp with surprising results when trying to simply slow hair loss.
I have several patients that we're using this on to help slow down hair loss, and we're starting to see new hair growth in some of our patients where we're injecting this specific product.
Sawich says the technology is here to expedite the process with minimal or no scarring, and Carl is a believer.
When I look in the mirror, I feel rested and I look rested.
Keith Jones, NBC 6, South Florida.
All right, now, existing scars can also be treated by stem cells and laser resurfacing. While the scars won't completely disappear, Sawich says most patients are happy with fading them by 90%.